Alan, hello. This is Emma from IMHU, and I'm very pleased to have you here to introduce yourself and your work.
Glad to be here today.
Thank you. Could you just let us know where you're speaking from and what organization you represent and work within?
Sure. I'm speaking from my home office in Northampton, Massachusetts. That's about an hour and a half west of Boston. I work in my home, and I'm director of the Neurofeedback Foundation as a 501c3 that is devoted to bringing neurofeedback into professional and personal and governmental, educational, health and mental health settings, both in the educational part and as well as helping people get launched into it themselves and providing services to underserved individuals and groups.
Okay.
I also support research, and I'm on a number of dissertation committees and foster the development of the field those ways.
Wonderful. Now I think you'll have to give us a brief rundown about what is this beast called neurofeedback, because some people don't know.
Sure. If you think of putting sensors on your scalp and taking the EEG activity that we're all producing all the time and displaying that to someone, is what neurofeedback is. We're putting the brain in a loop with itself, and for the very first time, a nervous system literally gets to observe itself working, and all nervous systems will do nothing but do what they can to optimize themselves. And this is a process that's automatic, is inherent in every nervous system, and proliferates across the entire range of human experience.
Well, why would I want to watch my brainwave patterns? Is there something that might help me in terms of optimizing my mental health by watching this?
The sentence I use here is that neurofeedback is a first pass, comprehensive brain augmentation technology with application across the entire range of human experience. Many professionals would use this to augment what they're doing in terms of what they do professionally, and that literally showing the brain its own activity below conscious trying is allowing the system of systems that are all going on underneath our cognitive drive activity to renormalize themselves.
Renormalize. So just in very plain English, if I'm having a bad hair day, is this going to help me?
Absolutely. The first thing that happens, people relax, people arrive themselves at the present moment. One of the first things people report doing neurofeedback is something like, people have to work harder if they're going to ruin my day.
Okay. So therefore, after having a session of, I think it's about half an hour that you could have a session in, that is a complete session, then
Correct.
I'd feel more, less agitated, maybe less depressed, maybe a little perkier.
The term I use is pleasantly present after a session. Sessions are 33 minutes in the way I do them, and that accumulating being pleasantly present tends to proliferate through everything people do as they have increasing numbers of sessions. And then what gets people in the door are symptoms or a complaint of some sort that tends to normalize. That
Great.
the brain, as the brain normalizes itself, what we used to call pathology, to whatever extent that pathology is not in the interest of the advancing of this nervous system, it tends to be dispatched, taken away.
So are you saying then that neurofeedback can be useful for people with relatively severe, what we call mental illness or disturbance, as well as people, for people who are basically, somewhat disturbed, maybe having a bad hair day or going through a stressful time?
Absolutely. Neurofeedback goes all the way back to someone in coma that it would be useful for, and everything forward from that. And the proverbial bad hair day or persistent depression, particularly things that people might be medicated for, as they add neurofeedback into that mix, the medications that people are on tend to be potentiated, with the result that many people use less medication as they proceed with neurofeedback training. That's particularly striking with kids who come in with ADHD and are on a stimulant, an antidepressant, an atypical antipsychotic, and a nice anti-seizure medication to control the side effects.
Okay, well, Alan, I'm going to stop you there because I know we have lots to talk about, and this has been just a brief introduction. And I'll say goodbye for now, and we'll come back later and talk some more, I think, especially about these learning difficulties. That would be great. Thank you very much for joining us.
Terrific.